Always looking for what other surgeons do that may be an improvement on what I'm used to doing. Until I worked with one particular plastic surgeon, all the drains had seen that came out of the incision came out of the corner. And as you can see on the top there, when you take that drain out, the patient has a round hole that needs to heal, and round holes don't heal that well. So this plastic surgeon would do what you see on the bottom there, that he would bring the drain in a couple stitches from the corner, and then when you pull the drain out, you have the stitches on either side. It does not leave a round hole. It's just a clean incision to close. And it was funny because introduced this to the other plastic surgeon that I work with a lot. And at first he said, well, it didn't really matter. But after a couple months, he started using it. And when I asked him, he said, well, yes, it does heal much better. So we've done it that way ever since.